Are you hoping for a boy or a girl? When I asked this question of expectant parents, almost without fail, the answer was, it doesn't matter as long as it's healthy. Out of all the wishes parents have expressed for their children, by far the top one was health. And although we can't actually give our children or grandchildren health itself, our actions can definitely improve the odds that they will develop health in both mind and body. Stay tuned to find out how. Hi, for those of you new to my channel, I'm Dr. Creadon Wright. I'm a board-certified family physician with over 33 years experience treating patients. Now that I've retired, I have the time to share the wisdom that I've gained from my education and patient interactions. And you have the ability to benefit from this without having to live through med school, residency, and patient care yourself. While almost everyone hopes their children and grandchildren will be healthy, most people don't have a conscious plan in place for that to happen. And as you may have heard, a goal without a plan is simply a wish. As a family physician, my role was not only to help cure diseases, illnesses, and injuries, but to actively work toward preventing them in the first place. I had no power over the genetics of any given patient. I would explain that their genetics were like the hand they were dealt in a card game. My role was to help them make the most of the hand they were dealt. In fact, many people who were dealt what might be considered poor hands genetically actually lived healthier lives than those patients who did not face the same obstacles. This was likely because those born healthy often took that health for granted, whereas those born with some of the cards stacked against them had to actively work to achieve the level of health they desired. You may be familiar with the following examples in public personalities. Jim Abbott became a successful Major League Baseball pitcher despite being born without a right hand. Sarah Reinersten's left leg was amputated above the knee due to a congenital bone growth disorder, yet she completed the World Ironman competition in Hawaii, swimming 2.4 miles, then biking 112 miles, followed by running a 26.2-mile marathon. Certainly, they had to have followed a plan to achieve those levels of health and fitness. So what components should we incorporate into our plans for health? The first component is nutrition. I was going to call it a healthy diet, but many people consider diet to be a restrictive lifestyle. In fact, there's a joke that says diet is simply die with a T. Nutrition is actually the fuel for our bodies. The best nutrition will help lead to the healthiest bodies. And although there will definitely be different approaches to the types of foods parents introduce to their children, the basic nutritional guidelines would remain unchanged. Let's start at the beginning. Feeding your infant. The guidelines that I'm about to offer apply to the majority of infants. However, there are definitely exceptions, such as guidelines for premature infants or infants with underlying medical conditions, such as deficiencies of certain enzymes. This is why it's so important to keep regular appointments with your child's physician so that they can screen for underlying medical conditions and give you guidance in regard to those conditions. Breastfeeding is a fantastic way to help your child develop optimal health. Not only will the breast milk provide nutrients, but it provides antibodies as well. In the first few days of breastfeeding, the mom produces colostrum, which is a bit thicker and more golden colored than the breast milk that will be produced later. Some people even refer to it as liquid gold because of its golden color and outstanding health benefits. The antibodies in colostrum can help your child fight off potential infections. Even if you decide breastfeeding is not best for you and your baby, if it is possible to breastfeed the colostrum for the first few days, you will be giving your child a big boost on proteins and antibodies with beneficial effects. After 3 to 4 days, the colostrum tends to be replaced with the thinner, whiter breast milk that will continue to be produced throughout the breastfeeding period. If it is possible to breastfeed, I recommend that. However, if it is something that you are not able to manage for whatever reason, Do not think that you're a bad mother. Your doctor will guide you to the appropriate formula for your baby. If you do solely breastfeed, though, you should supplement your baby with 400 international units of vitamin D daily to help with bone development. For most babies, I recommend feeding on demand, meaning feeding your baby when they show signs of hunger rather than on a schedule. Your baby should wet at least 6 times over 24 hours. Fewer than 6 wet diapers could indicate dehydration. In most situations, no supplemental water should be given because formula or breast milk should provide enough water in it for hydration. If you supplement with plain water, your baby's tummy may fill up with water, causing him or her to not get enough calories for the desired growth and development. You should continue breast milk or formula for the first 12 months of life to optimize your baby's health. In the second 12 months of life, it is recommended that you feed whole milk rather than 2% or skim milk to help your baby's brain development. Your baby's doctor will be able to guide you in the introduction of solids throughout the first year of life. It used to be thought that highly allergenic foods such as peanuts should be avoided for the first 2 years of life. But now the pendulum has swung the opposite direction in that early introduction of peanuts is now being advised to help reduce the likelihood of developing allergic reactions. Again, though, it is important to do this under the guidance of your baby's physician, especially if there's a family history of a peanut allergy. For the first 4 months of life, though, breast milk or formula is typically all that's advised. Optimizing nutrition in toddlers has its own set of challenges. They may want macaroni and cheese or chicken nuggets every meal, every day. On the one hand, you want to optimize nutrition and raise a toddler who will eat a variety of foods. On the other hand, you don't want to end up with every meal becoming a battleground in which meal times become a standoff rather than a sharing time of food and news of the events of the day for each family member. Some of my patients even had eating disorders that they attributed to the battles over food in childhood. I recommend having your toddler taste each of the foods that you introduce at each meal. But if they don't want to eat that food as their entire meal, allow them to eat a healthy food that they enjoy. It is a good idea to supplement with an age-appropriate children's multivitamin. Often, as children see their older siblings and parents enjoying foods that they are not eating themselves, they ask for a serving for themselves. I don't recommend having them have junk food as an option to fill up on. Dessert could be a serving of fruit, but it shouldn't be cookies or cake every day. And avoid talking about which foods you don't like. Many a toddler has stopped eating a food that they previously enjoyed simply because they heard mom or dad say that they don't like that food. As they taste more and more foods that are unusual to their palate, they may adjust and start to ask for those foods as well as their usual favorites. Adolescents and teenagers often struggle to gain control over their environment. Many don't want to be picky eaters because it's embarrassing for them to be invited to a friend's house but not like what that family has offered as a meal. It has been said that a person needs to try a new food at least 9 times before they can truly say they don't like that food, as the palate takes time to adjust to a new taste or texture. Strawberries are a common example. Many of my patients liked the flavor of strawberries, but the texture of the seeds in the strawberries was repulsive to them. I would explain that just touching their tongue to a strawberry did not count as a taste, as they truly needed to take a small bite, chew it, and swallow it in order to really experience the taste and texture in order for their palate to adapt to the new sensations. Many times, the adolescents in my practice did not realize that they could learn to like foods by trying them multiple times. They had just assumed that the foods they didn't like would be foods that they always wouldn't like. The thought of eating an entire serving of a food that they found repulsive was almost impossible to them, but a small bite was manageable, especially with the end goal of potentially liking that food after 9 tries. Additionally, by adolescence, children should be able to start helping to prepare meals. Often, selecting the ingredients and preparing the meal help these children to truly learn to like the foods they prepared. Additionally, it allowed them to have a sense of pride in being a contributing member of the family by preparing a meal or a side dish. Exercise is another vital component of health. If you've ever watched a group of toddlers playing, you've seen that they run and laugh with the joy of moving their bodies freely in the fresh air. Time needs to be allotted throughout the day for movement. This will allow the development of a strong cardiovascular and musculoskeletal system. It does not necessarily need to be an exercise program, but simply some fun, active play. After the first 12 months of life, having access to fresh water for hydration is essential. I've actually seen toddlers with pop in bottles and sippy cups. Pop has no nutritional value and certainly is not good for hydration. Also, many parents give juice for hydration instead of water. Although juice is natural, it is very concentrated in sugars and therefore should not be consumed in excess. A single glass of juice with breakfast is fine, but when a child is thirsty throughout the day, they should be reaching for their cup of water to optimally rehydrate. And a consistent bedtime in a dark, quiet room allows the body to refresh and recuperate from the activities of the day. A TV blasting in the next room is not going to help a child fall asleep easily. And I would be doing a disservice in a talk about health without mentioning immunizations. To some, this is a controversial subject, but to me, it is an easy decision. I had patients in my practice who were partially paralyzed from polio. What they wouldn't have given to have had a polio vaccine available to them at the time they contracted that disease. I'm also old enough to remember the tragedy of epiglottitis. When I was a medical student, if a young child had a croupy cough, they often had to be rushed to an emergency room because it might not have been simple croup. Instead, a type of bacteria called Haemophilus influenza type B, or Hib for short, could infect the epiglottis in their throat, causing it to swell and completely obstruct the airway. 2-year-old died on the way to the hospital because of this. Now that Hib is a routine part of childhood immunizations, I've not seen a case of epiglottitis in decades. I understand that there's a potential for side effects or allergic reactions to immunizations, but the risk of that compared to the risk of the diseases themselves make it simple for me to keep up with my own immunizations as well as recommending them to those I love. Find a physician that you trust to review which vaccines are advised for your child and why. There are so many ways to give your child or grandchild the gift of health, but one that is often forgotten is setting a good example with your own healthy lifestyle habits. Live the life that you would like your child to live, and with any luck, you may share many years of health and happiness as you fill your family history book with cherished memories. If you're enjoying this video series on the most precious gifts that you can give your children and grandchildren, please like and subscribe to my channel so that you will know when the next video is being released. Also, I'd appreciate it if you'd share my videos with friends and family members that you think might enjoy them as well.